Hello there, and welcome to Mindful Moments. I'm Dr. Natanya Wachtel. I've spent years working with patients, families, and healthcare teams as an advocate for overall well being and supporting skill building for betterment. I'm here each week to help you focus on supporting your mental well being as a caregiver. If you've missed any episodes, you can go back to them on the self care page of the Smart Caregiving website, and you'll also find some helpful resources if you need them. If you're new to the program, I can share that the purpose of Mindful Moments is to help you start to pause and take a breath, to move from busy or worried mode into a more relaxed mode where you can feel a sense of calm and peace. And this is how we actually rewire the brain and get real health benefits, like lowering your blood pressure or reducing stress hormones and more. But we need to practice small and often. So let's get started. Each episode, we do some breathing exercises to just help us center, focus, and let go of the day. Together, we're going to do 2 deep breaths into the count of 4, hold to the count of 4, and release to the count of 4. When you're on your own, I suggest you do this 4 times to get the maximum benefit. Let's begin. You can close your eyes or do a soft focus or leave your eyes open, whatever is most comfortable for you. So today I'm going to start with a quote from Rosalind Carter. She was a prominent advocate of caregiving, and she famously stated that there are 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So, what does this mean? This means this is you, and this is me. This is all of us. Caregiving is all of us, and we need to stick together and support one another. But if we're being honest, caring for another person can be stressful. And even though family caregiving is one of the most rewarding and selfless acts of kindness a member can provide, it is challenging. And those challenges can match its gifts. There are ways to navigate through stress that can help avoid caregiver burnout. So today's mindful moment is in 2 parts. In part 1, we're going to go over some tips, and in part 2, we're going to continue. We're going to use those tips to help honor and relieve some caregiver stress. Because it's a fact, caring for another person can be stressful, and there's no reason to feel guilty about it. We're going to honor and address the symptoms of stress and the root causes of that stress with tips from caregivers on how to relieve the tension that we'll expand upon in part 2. Let's start with a definition, though. What do we mean by caregiver stress? Caregiver stress is the physical and emotional strain that results from providing continuous care for another person. When the stress is prolonged, it can cause serious physical and mental health problems for those providing the care. Caregiver stress may be the precursor to a more severe thing called caregiver burnout, though many of the symptoms can overlap. So, what are the symptoms of caregiver stress? Well, as a family caregiver, it's important to keep an eye out for any negative physical or emotional symptoms you experience, because these can lead to actually long term damage. Some physical signs that you may be experiencing caregiver stress include frequent headaches or body aches, always feeling tired, sleeping too much or even too little, rapid weight gain or rapid weight loss, and abusing alcohol, recreational drugs, or prescription medications. Emotional signs of caregiver stress include moodiness, where you're easily angered or irritated throughout the day, persistent sadness or hopelessness, a lack of interest in previously enjoyed activities, and feelings of loneliness or isolation from other people, even though you may not be physically alone. So it's known that the long term effects of this kind of stress can be detrimental to your health. And just as a reminder, this long term symptoms can include serious mental health issues such as severe anxiety and depression, a weakened immune system, which makes you vulnerable to disease, severe or moderate digestive issues, alcoholism or drug addiction, increased risk for chronic diseases, and short term memory loss. So, what are some of the causes of this stress? Well, some of them include the obvious: financial strain, the relationship role changing, and a lack of rest for the caregiver. So, if you or a loved one are experiencing signs or exhibiting signs of caregiver stress, it's important that you try to talk to your doctor or therapist or social worker or even care teams of the person you're caring for about ways to ease your symptoms. There are many holistic remedies, medications, and therapies that are designed to help. The financial aspects of caring for your loved one can be one of the most troubling for caregivers. And caregivers often spend less money on their own leisure activities. Nearly half reports a decrease in going out to eat or taking a vacation or any fun activities due to the cost of caregiving. Another cause of stress can be the emotional impact that comes from a reversal of caregiving roles. For example, if you're caring for a parent or an older sibling, it can be rather disorienting to start taking responsibility for someone who was previously responsible for you. And lastly, many caregivers neglect to give themselves the additional rest necessary for good health, since your primary focus is often on your loved one. Providing frequent support for another human is essentially doubling the work our bodies are designed to do. We all have a finite amount of energy, both mental and physical. But when we refrain from taking regular breaks, we run on fumes and aren't giving our own bodies what we need. Can you relate? The first step I ask you then is to please forgive yourself. Recognize this and honor it. It is natural, it is common, it is expected, it is normal. Giving your own body the mind the care that you need is the one of the most important components of being a good caregiver. Remember, giving your own body and mind the care they need is one of the most important components of being a good caregiver. So let's talk about some tips for managing caregiver stress. We will continue these in part two. The feelings of tension you may feel as a caregiver can frustrate and exhaust you, but fortunately, there are plenty of helpful techniques you can use to manage your stress. I've collected feedback from thousands of real caregivers on how they manage the pressure. And here are some of the favorite tips. One of them is to complete a small task to regain a sense of control. So, when you're dealing with someone else's fluctuating health, it's totally normal to feel overwhelmed, out of control. And if this describes you, here's one caregiver's simple but really helpful tip. For her, doing laundry was soothing. Just one load. If she was feeling overwhelmed, she'd tell herself that she could do one thing. And it was helpful for her to make some order out of what she felt was chaos. She would feel from doing that laundry that she had control over something, and it felt greatly satisfying to see that neatly folded pile of clothes to throw herself back into the fray. Another area that we often neglect is eating, and eating as a way to nourish and fuel yourself. When we put our bodies into them is what we get out of them, and proper nutrition is crucial to self care. What we put into our bodies is what we get out of them. Proper nutrition is crucial to self care, and that can be left to the wayside when you're under a lot of stress. However, stressful times are when your body needs healthy fuel the most. Try to avoid skipping meals, eating just lots of snacks without protein, or overindulging on alcohol or drugs if possible. Instead, if you can, set aside regular time each day to actually enjoy what you eat. Ideally, 2 to 3 square meals a day. And some stress relieving foods can help, like tea and salmon and even dark chocolate. The last tip for the day is about practicing getting more sleep. And yes, it is practice. When your mind is racing around a track with a million things to do, it's only natural that your sleep may suffer, but you can't avoid it. Your body and your brain unquestionably need time to recharge. Amazing things happen when you sleep. muscle relaxation, tissues grow and repair, and energy is restored. How well you sleep affects nearly every aspect of what happens to you in your waking hours. So make sure to try to get those quality Z's. If you can, set yourself an alarm and aim to get at least 7 hours each night, preferably at consistent times. Now, that's all we have for today, but please check back for part two next week. And remember, you can always visit me on the self care page of the Smart Caregiving website. I'm Dr. Natanya Wachtel, and this was another mindful moment.